Good morning and welcome to Grand Rounds. Today we have Jessica Novrosky talking to us about the International Dysphagia Diet Standardization Initiative so that we can get an update on this wonderful initiative. Ms. Novrosky received her bachelor's degree in communication science and disorders from the University of Pittsburgh in 2009 and continued on to receive her master's in speech and language pathology from Radford University. She's certified in Vital Stim and Vital Stim Plus, LSVT loud, and myofascial release for voice and swallowing impairments. Ms. Novrosky recently became a certified brain injury specialist and a dementia care specialist. She specializes in the treatment of speech, language, and swallowing disorders as a result of neurodegenerative disease, head and neck cancer, traumatic brain injury, concussion, and stroke. Ms. Novrosky practices at St. Luke's Physical Therapy at 8th Avenue, and she is a member of the American Speech and Hearing Association, using the most up-to-date treatment techniques supported by the latest research. So I will now turn it over to Ms. Novrosky.
Thank you, Steve. Welcome, everyone. So as Steve said, this Grand Rounds is an introduction or an update to the International Dysphagia Diet Standardization Initiative, also known as IDDSI. So many of you may have heard about this. I don't know if any of you have looked more into it. I took some classes on ASHA to kind of understand what it is. This isn't something right now that's been completely adopted in America or St. Luke's as a network, but it possibly could be part of our future. So I feel like it's good to kind of just get some awareness of what this new terminology is going to be. So a quick disclaimer about everything is popped up here about St. Luke's. This is me and where I work. So as Steve said, I'm an outpatient neuro rehab center on 8th Avenue in Bethlehem. So the IDDSI classes that I took and the website I used talked a lot about some copyright. So I wanted to put that on here. Everything that I got came from them, all the videos. So these are just those disclaimers. Okay, so as I said, we're introducing you guys to IDDSI today. So this course is going to provide you with an up-to-date review of diet texture modifications for adults with dysphagia and introduce the IDDSI framework for standardizing dysphagia diets. So IDDSI.com recommends this as a process. There's sort of three main steps. The first one being building awareness across the facilities. So this is awareness for not just clinicians, but administrators at the top, working with supply chains and communicating everybody about how this is going to happen, when it's going to happen, how long they expect it to happen. This takes a lot of preparedness in order to adopt it. So again, today we're just going to talk about awareness, just becoming familiar with the new terminology and how to test for these new diet levels and everything that goes along with it. So the objectives I have today are to demonstrate understanding of the valid measurement techniques to determine the appropriate consistency of food and drink using the IDDSI standardization framework. We're then going to identify terminology and definitions for textured modified foods and thickened liquids using this IDDSI framework. So what is IDDSI? So it's basically common terminology to describe food and textures and drink thicknesses across the world. As many of you SLPs out there know, some people call it nectar thick, honey thick, dysphagia, mechanically altered. You know, there's a lot of different terms that, depending on where you studied or what the community you work around, you know, we all have our different terms we use, but we also have our different thoughts of how they are mixed and how they look. You know, there's measurements, you know, and pre-ordered materials, but you know, if we're mixing, we kind of eyeball it sometimes. So this is to give us more of a standardization from therapist to therapist and network to network. So originally the framework for this initiative came out in 2015. It was most recently updated in 2019. And that update basically added a subcategory to the highest level, level 7, adding this easy to chew sub-level. So we'll get into that in a little bit. But IDDSI itself is a description of a diet, not necessarily a prescription. So they talk about providing this standardized terminology, but they still obviously require a lot of clinical assessment for the patient, and you must work together, as a team to be able to individualize these diets. So everything we're going to talk today was taken from other diet standardizations that we know. And basically when they started this process, starting in 2015, probably even before then, talking about it, until now, it's still in the works. They came up with a board of all different kind of medical professionals, did systematic reviews all over the world. And basically there was a common consensus that there was a need for this international terminology definitions for modified foods and liquids. So this is where this global initiative began. So when I mentioned the board, it's an international organization composed of registered dietitians, speech-language pathologists, occupational therapists, doctors, nursing, some food scientists, engineers, and these professionals span with knowledge from newborns to elderly as far as their dysphagia experience. So in a 2013 and 2014 stakeholder survey, IDDSI came back finding that only 40% of respondents are checking that texture modified foods and thickened liquids are of the appropriate consistency before serving them. So this kind of got everyone's eyes a little wide and thinking we need to really have more of a standardization of how we test things. That way we feel more comfortable serving it for the patient's safety. So we're going to jump into the levels of the IDDSI framework and what they all mean, and kind of go over how to test for them then. So there's 8 levels on the continuum, level 0 to 7. So when we're looking at drinks are level 0 to 4, and then food levels overlap a little bit with the drinks and go from 3 to 7. So this is the IDDSI framework. So it's these triangles with colors and numbers. If you've seen them in articles or online, this is what it is. And it's a scale that captures the degree of diet texture restrictions you're going to recommend for the patient. Again, as you can see up there on the top left, regular and easy to chew in the black is kind of split. That was that 2019 edition where they added that subcategory of easy to chew. One of the things, just looking right at it, there's 3 ways to access a patient's level. You can go by the number, you can label it by the color, and then also the label itself of the terminology. So using those 3 should help keep things consistent. Okay, so level 0. So we're at drinks here right on the bottom. So this is considered thin liquids. It's the color white, quote unquote normal. So this is something that flows just like water, tea, coffee, juice, straight up thin liquids. Then we move up the triangle to the gray, level 1, which is slightly thick, is the terminology that we're giving this. It's more of a naturally thick, they say. They gave examples such as more of some like fruit nectars, some milks can be slightly thick. They are thicker than water, but they can still flow through a straw. So that is the definition of level 1. Level 2, again, we're here with drinks, moving up on that triangle. This is considered mildly thick. It's in the color pink. They describe it as quote unquote syrup thick. This is known to be something that is somewhat sippable, flowing off of the spoon. However, you need some effort to drink it through a standard straw. They gave the example of some milkshakes can be considered mildly thick. Okay, level 3. So this is going to span across both foods and drinks. So as you can see on the right, level 3 is both moderately thick as a liquid or liquidized as a food. So both of these are considered, or in the yellow color, and they are considered these custard thick. So they can be eaten from a spoon or taken from a cup, but making sure that they are smooth and no lumps. Okay, level 4. So level 4 is another one that is in both food and drink. And this is in the drink category, considered extremely thick. And the puree, it is, and in the foods, it would be pureed. So as you can see, these are both the green color. They also describe these as being pudding thick. So if we think about how we talk about drinks, pudding thick would possibly be a term you've used in the past to describe a thickness of a liquid. So these are going to be eaten off of a spoon, not from a cup or straw. However, there's no chewing required because it's completely smooth, no lumps, and has to hold the shape on a spoon, not being too sticky. Okay, up to level 5. This we're calling minced and moist. This is an orange classification here, and this we can describe as something that is pre-mashed or mechanical soft. It must be soft and moist. However, no liquid can be leaking out of it, and it requires more minimal chewing. Okay, level 6 up here is soft and bite-sized. So this is the blue category over here, and they consider this to be fork mashable, or more like a dysphagia advanced food. So this is something that's soft, tender, and moist. Again, no liquid leaking out of it. You have to be able to chew bite-sized pieces to safely swallow it. Something kind of mashable with a fork, like I said. All right, now we're up to the top at level 7. So we're going to first talk about that subcategory, easy to chew. So it's the same color as regular, as that black. We're talking more about normal foods, but those of a soft and tender texture. With this level, they don't talk about any size restriction, and the others we do, and we'll get into that. But the easy to chew has more to do with if we have concerns about their chewing ability as being the only concern. So we might perhaps be talking about a limited dentition or inappropriate mastication. We want to give them an easy to chew diet. So you should be able to cut them with the side of a fork, nice and easy to break apart. No nuts or raw veggies, steak, popcorn, that kind of stuff wouldn't fit into the easy to chew category. Oops. Okay. Then top of the list here is level 7, which is regular. So we're back to our normal, no restrictions with food. This is considered, like I said, normal, and there's no testing or limitations required with a regular diet. So this was a picture that I found that kind of parallels some of the terminology we may be familiar with that of IDDSI. So obviously regular at the top being the same term we use when we talk about the food that we recommend when there's no concerns for dysphagia. So then when we step down to what we may call dysphagia advanced, that's where we're looking at that level 6, soft or bite-sized is the term they're providing. Down from there, we would call dysphagia mechanically altered. They are calling minced and moist. And then that puree terminology did not change. So I did want to touch upon transitional foods. So transitional foods are those that start as one texture and then change when moisture is added to that food or a temperature change happens. So adult transitional foods we can use to help reteach chewing skills. So things like wafers, shortbread, veggie sticks, cheese puffs, ice cream. These are all those transitional foods. So they necessarily don't have much nutritional value in them, so we're not going to consider them a diet level. You may suggest them perhaps with another diet level, but it was just something that they wanted to bring up as one of those questions because it doesn't really fit in the category because it's of its own. So some of you may notice as we went through the categories, I didn't give you many examples of especially foods. You know, the IDDSI initiative talks more about how to test the food you're giving them to make sure it fits those requirements, and shied away from like bananas are definitely in this category and meatloaf is definitely in this category. It's just more about testing things, because your mom's meatloaf might be different than your grandma's meatloaf. So it's really kind of a more about how to test them. So these are the tests, and we're going to go over these and have some videos on what it looks like when we test them. So the first one is what's called a flow test, and this measures the viscosity of liquids. So we're looking at those levels 0 to 3. We have a fork drip test measuring thickness, a spoon tilt test measuring stickiness, a fork tine test looking at the size of the particles to make it within appropriate for that level, and then a fork pressure test measuring softness. So we're going to start with the drink testing methods. So when we talk about drinks, viscosity is not the only parameter. You know, when we think about drinks and making thick drinks, you know, we look for that nectar, honey, that viscosity. But we got to think about other things. So drink flow can be influenced by density, yield stress, temperature, propulsion pressure, and fat content. So this is where that like food scientists, people on the board, and the engineers really played a role into how to make this kind of easy for us to test without having to worry too much about all those parameters. So they just developed this IDDSI flow test, and it's a gravity flow test using a 10 milliliter slip tip syringe. So it's important to test the liquid in the intended serving temperature. So if we are testing coffee and they want to drink that coffee hot, we must test it while it's hot. Same thing with cold things. So all of the temperature does play a role in the engineering of how everything flows. So the syringe, what they found is a controlled condition that represents the way that the liquid moves when it's swallowed. And they found that the flow test is sensitive enough to demonstrate small changes in thickness associated with changes in things like serving temperature. So we're going to pull up the first video. And it's gone. Sorry. It just went to my PowerPoint, or to me. Okay. So this talks about the flow test. So this is measuring our liquids. So what we're going to know, we need a 10 milliliter syringe and a stopwatch. So first we're going to take the plunger out of the syringe. We don't need that. Making sure that the syringe is clean, new, nothing blocking it up. You're going to cover the nozzle of the syringe with your finger, making a complete seal. So when you pour liquid in there, nothing's going to come out. So what you do is you fill another syringe to the 10 milliliter line, so what you're testing, and fill it completely up. So you've mixed your liquid, it's ready to go, you put it in the syringe. You take your stopwatch and remove your finger, and you count, or you time for 10 seconds while it's flowing through. And then once you hit 10 seconds, you get your pinky right over there. Yep. Stop the liquid from flowing. And whatever's left in there is going to classify what level you're at. So there is between 1 milliliter and 4 milliliter remaining in that syringe. So that gives it a level 1 IDDSI flow. Okay. Okay, so then okay, so now we're going to look at a flow test of comparing, levels 1 through 3, so kind of all next to each other. So we saw how to set it up and fill it So we're going to look at 3 across the board and watch how differently the consistencies flow. So as you can see, they're labeled there with the number and the color. So we're timing for 10 seconds. As soon as you hit that 10-second mark, you go ahead and cover that nozzle. And then you use the number that's left in there to provide it with the classification. So that's what levels 1, 2, and 3 look like compared to one another. Okay. Okay, so some testing tips that they recommend is when you're using a commercial thickener to make sure you're still following the instructions, mixing thoroughly, making sure there's no lumps or bubbles, and allowing for the recommended time for the fluid to completely thicken. Using a clean, dry syringe, checking that the nozzle of that syringe is clear with no residue to make sure that flow goes through. Testing twice or more to ensure reliability. Testing the liquid again at that intended serving temperature. And then liquids such as gravies, sauces, and shores, all of those can be used with this IDDSI flow test so you know what level you're looking at. When we talk about the extremely thick drinks at level 4, this we recommend the spoon tilt test, not the flow test. So we'll talk about that in a minute. So again, these food testing methods, we're taking into account things like the hardness of them, the cohesiveness, slipperiness, size and shape, and the testing methods for the food are listed on the right here. So things with forks and spoons for drippage and pressure, but they also give or provide testing measures with things like chopsticks and fingers just to stay culturally relevant and appropriate across the board. So thick drinks and fluid foods, such as levels 3 and 4, we're going to be using what's called a fork drip test. What this does is assess whether they flow through the tines or the prongs of a fork. So as you can see in these pictures on the left, the level 3, which is that liquidized or moderately thick, is going to drip slowly or dollop through the tines of the fork. While a level 4 will need to sit in a mound on the fork itself without falling through. A spoon tilt test measures samples in those levels 4 and 5. So we're talking about pureed level 4 and minced and moist level 5. So what a spoon tilt test is there to do is to determine the stickiness of the food and its ability to hold together. So the sample that you should be testing should be cohesive enough to hold shape on a spoon, and a full spoonful of this consistency must plop off the spoon when tilted, or kind of give a gentle flick of the wrist with a little bit of film remaining on the spoon. And then the scooped mound on the plate should spread slightly on the plate. So here's a picture of what a spoon tilt test would look like. So again, we're holding the spoon on its side. You can see the bolus has its shape together. It's not too firm or sticky, and it falls off the spoon onto the plate without leaving much residue on the spoon. So let's take a look at a video for that spoon tilt test. Okay, so we're looking at level 4, extremely thick for a spoon tilt. So it falls off the spoon, residue. Yep. So this one, they're saying would be too sticky because it's not sliding right off the spoon. They have to give it too many shakes. So that's sort of the difference. It's really falling off the spoon versus it's sticking. So that's all about the consistency of that. So okay, so we're going to jump back here to talk about particle size. So when we talk about level 5, which again is that minced and moist food, one of the things that they classify for this level is particle size. So they recommend that there be a 4 millimeter particle size compliance with this diet level. With adults, the average particle size of chewed solids before swallowing measured at 2 to 4 millimeters. So they found that the slots or the gaps between the tines of a standard metal fork typically measure around that size. So it's another great way to use our forks and spoons to help with this testing. So that picture on the right shows some kind of ground meat, perhaps, where on the left picture, the grounds of that meat fit between the tines of a fork, which is appropriate, versus the picture on the right where it's a solid piece that spans the level of the fork, which would be too large. When we increase the diet to level 6, we're talking about that soft and bite-sized level. Our particle size is larger. So here we're looking more at a 15 millimeter or 1.5 centimeter particle size compliance. For hard and soft solids, a maximum food sample size is 1.5 by 1.5 centimeters, which they found to be about the size of an adult thumbnail. And this is just also the entire width of a standard fork. So trying to make things as relatable and easy as possible so you're not breaking out a ruler, but giving you, again, some measurement to help keep everything as standard as possible. So, why are we worried about size particles with these levels? They did lots of studies on how the size of the bolus can reduce the risk of associated asphyxiation from choking on food. In regards to the pediatrics, the particle size for infants are smaller than the maximum width of a child's 5th fingernail, is what they said. That might cause a choking risk. So all these measurements regarding choking risk were used to predict the internal diameter of an endotracheal tube, especially with that in the pediatric population. So obviously, anyone that has a dysphagia, we don't want things were to go down the wrong way. We wouldn't want them to get stuck, so we want them small enough to pass through the trachea. So then the fork pressure test. So we're going to talk about level 6 here, that's soft and bite-sized. And the fork pressure test requires applying pressure with a fork until your thumbnail blanches white. Teaspoons, chopsticks, and fingers are also incorporated in these testing measures when a fork is not available or culturally relevant. So as you can see on the right there, I believe it's a banana. They're pushing down on the banana until the thumbnail blanches white and it's breaking up fine. This usually samples like this don't return to its original shape once the pressure is released. There's also kind of a side test here where with a fork and spoon separation test, where they must be able to break the food apart easily using the side of the fork. So that is the picture below, and that easy to chew, where they can break it apart with the side, mash it, and their thumbnail blanches white. So the pressure applied to make the thumbnail blanch white was actually measured in studies using the IOP. And it was measured at approximately 17 kilopascals was the average that makes your thumbnail blanch white. And this was consistent with tongue force used during a swallow. So I thought that was kind of interesting. Now we know. Okay, so minced and moist. So let's go back to the video on the fork pressure test. Okay, so minced and moist fork pressure test with meat. So here they're pushing down on the minced food. Fork drip test would be them scooping that food up on the fork without letting anything pass through, so it's not too liquidized there. Using that same meat to do a spoon tilt test. Slowly pops off, no really need to flick the wrist. A chopstick test with the same level of meat. Lifting it up, sort of similar to the fork drip test. Same thing with the fingers, able to kind of keep it in that consistent form without breaking apart too much. So those are ways we can test that minced and moist appropriate level. Okay. All right, so fork pressure test. So we're going to look at level 6, soft and bite-sized. So broccoli is what they're going to use the fork pressure test with here. So they're going to push down, it breaks apart, sticks to the spoon, that passed the test. This one they're pushing down, not breaking apart as easily, so that one does not pass the test, a little too hard. So we're going to do that same pressure, but now with chopsticks. So soft enough, breaks apart. And then the second piece, they're going to try to manipulate as well. Not breaking apart enough, so that one did not pass. And then lastly, same idea with the broccoli, but just with the fingers. Giving it that pressure. It's nice and mushy, breaks apart, soft enough, so that passes. Second one does not squish in the hand, so that does not pass. Okay. All right, so a little bit ago, I brought up the transitional food texture kind of as a side note. What they did here was talk about how we can assess for this transitional food. So again, transitional foods start off as one texture, such as a firm solid, and change into another texture, specifically when there's moisture added, or a change in temperature, so if they get hot. So when testing these food consistencies, they recommend applying a milliliter of water on the sample and waiting a minute, and then applying using the fork pressure test the way you would with other solids. So the sample is considered to be a transitional food texture when the sample has been squashed and disintegrated and no longer looks like its original state. It can be easily broken apart with minimal pressure, or it has been melted and there no longer looks like its original shape, such as an ice chip or ice cream. Okay, so this is going to be the last video we're going to look at, and this is a minced and moist sandwich example. This one's a little bit long, but they're going to walk you through how to make a sandwich that is considered IDDSI level 5, minced and moist. So all of us know that bread is a super enjoyable food, has nutritional value. Although we think of bread as being soft, it's probably one of the most common foods that can cause a person to choke. It takes a lot of chewing action, tongue and jaw movements to break it down and make the bread safe to swallow. In this video, it shows how quickly a piece of food like that can get caught in a person's airway, causing them to choke. So how do we make sandwiches available for people with chewing and swallowing problems? With some modifications to the bread and careful choice of filling, sandwiches can be back on our menu. So we're going to walk through this example of how to make the steps of a minced and moist sandwich. So first, removing the crust from the bread, using a food processor to finely chop up the bread into tiny pieces, meeting that 4mm size requirement. Please note that store-bought dried breadcrumbs are not suitable. They're too hard. So for a single sandwich, you're going to use a square mold to shape the sandwich. So you're going to sprinkle the equivalent of a slice of finely chopped breadcrumbs within the square mold. You can spray the chopped breadcrumbs with either water, milk, broth, some sort of flavor to make it moist. Add a filling that's considered that minced and moist level. So in this example, it is an egg and mayonnaise salad. So you're going to scoop that on the breadcrumbs and then smooth it out evenly over them. adding another layer of the breadcrumbs as the other half of the sandwich. So same idea, sprinkle the breadcrumbs on, and we're going to spray it with the flavoring or the water just to moisten it up. Removing the mold. And then they recommend covering it with wrap and refrigerating it for at least an hour so the moisture can permeate through the breadcrumbs. And after the sandwich has been refrigerated, you can remove the wrap, divide it into whichever way you'd like to serve it. And then the fork test, spoon tilt test, all of that should hold together well. So while it looks like a sandwich, you'd probably be easier eating it with a fork or spoon, but it will still look and taste like a sandwich. And the important thing is it's reducing their choking risks, but they're still allowed, can have bread at this level. So they're showing the gaps of that bread fitting that 4 millimeter, using the fork test. Spoon tilt test to make sure the spoonful of the minced and moist sandwich can be scooped together, holds together on the spoon. Sorry. Very little food left on the spoon. So again, bread can be one of those foods we all want, but with chewing and swallowing problems can be difficult. So this was just an example of a way to get it back on the menu. All right. Okay, so the overview and takeaway is we're wanting to improve safety for patients with dysphagia through common terminology. So this is all ages, all care settings, all cultures. The hopes of IDDSI is to reduce any confusion or uncertainty regarding these diet levels, which is why they go very in depth on these testing measures. We're going to enable caregivers and to be able to test for themselves. So these require very common tools, not too much to make it difficult to test at home. In regards to more information, so this is a lot for us. I totally understand. It's definitely a new world that we could be heading towards. The great thing is that IDDSI website, all the articles, the research, everything is free, open access. Their website has a ton of wonderful resources to help with these transitional phases. So again, today was really just about awareness, being familiar with the terminology and the testing measures and everything like that in order to transition into the preparedness and adoption. All of that is laid out on their website when and if that happens. So there's also an app that they recommend that kind of as a shortcut to some of these levels and testing measures. Could be something good to have a family have if they have questions or forget how to do a certain test. It could be available as easy on an app on a phone. This is just a screenshot of the IDDSI website itself, pulling up resources. Like I said, they have all sorts of things to print, logos, charts, guidelines, anything you need as reminders. Those were all the videos we watched today, and those were all thanks to the IDDSI website. That everything was created through them. Some references. And that is it, guys. So please feel free to shoot me an email or ask me, call me, any questions you have regarding this. Definitely something to keep the conversation open with between us so we can continue our best care and updated practices and evidence-based. So again, thanks for listening and have a great day.